Hello again. This is Senator Harriet Chandler of the 1st Worcester District, and this is Beacon Hill Chat, your show that brings interesting people in to talk about interesting things going on in our community. And today we have with us Dr. Laurie Ross, who's an associate professor at Clark University. And she's also, and we're going to be talking more about this, the co-director of the Compass Project. So we welcome you to the show, Laurie, and we're here today to talk about a program that you've been involved in for a long time, that I'm somewhat involved in as a member of a commission on homeless and unaccompanied youth. Yeah. And you've become the authority, basically, certainly in Worcester, but you've become one of the authorities in the state on this issue. And the Compass Project and what they've done to respond to particularly the barriers that these youth find.
Sure. And each year we are able to we've surveyed between 500 and 1,000 young people. And each year the rate of homelessness in that sample has been somewhere between about 12% and 19%. Last year it was 16% of that sample. So 120 youth were homeless. And we define it, there's basically three major categories. One is young people who are in shelter who are unaccompanied. So they are not with a parent.
They're alone.
They're alone. They may have a child of their own, but they're young, they're under 25, and alone. So about half of the young people in the sample are in a shelter. Then there's something called couch surfing. And this is this fuzzy area that sometimes people have a hard time with, but it's young people who, for whatever reason, they've been kicked out of their house, they can't stay in their house, but they're basically going from place to place, sometimes for a long time, sometimes they're having to move every couple of weeks. And so this couch surfing phenomenon is about another third of the youth that we sample. And then the last portion are young people who are actually on the street, in buildings, in cars. So more who you think about as being homeless.
Worcester's doing something through your survey that's most unusual.
Yeah. With
don't you speak about that?
In regards to the Compass Project?
Right.
So what we're trying to do, and which is with the project that we have, we're really trying to prevent youth homelessness. But as our conversation has gone, it's very hard to predict who's going to become homeless. You can look at risk factors, but you don't know for sure who's going to become homeless. And so to prevent youth homelessness, you really need to have a community approach. People need to be aware of the issue. And then people working at the front lines in youth agencies need to know what the signs might be that a young person is struggling or vulnerable to becoming homeless. And so what we're doing through the Compass Project is we're actually creating a network of community agencies that we're calling basically low barrier access points. So they're places that a young person can come in, the staff there know what the signs might be. I mean, some of the agencies are already the front lines. Okay. So with SMOC, I mean, young people can come into the triage center already. But other places that a young person might be going anyway, and then also might be vulnerable to homelessness. So places like, the Boys and Girls Club and the Worcester Youth Center, the Straight Up Cafe, places like those. So to be sure that the staff know what some of those signs might be. And then what we're doing is we're moving to a common screening process. Mm-hmm. So these 15 or so organizations are all using the same protocol. And what that basically means is that a young person will not have to tell their story multiple times. In what they call kind of almost in a re-traumatizing way. The more times you have to tell your story, the harder it is. And if you don't get the help that you need in the first place you go, you're less likely to go somewhere else. So we're trying to have a coordinated approach. And in fact, one of the things that we learned from the survey is that only 30% of the young people who are homeless got what they needed when they sought help.
Really?
And so that really is a compelling statistic for us to make this network work.
Now you're in the third year of a grant.
Yes.
Talk about that grant, because what has that enabled you to
Sure.
do? The grant is from?
Yeah. The grant's from the Health Foundation of Central Massachusetts.
Okay.
And they have this more or less a 5-year synergy grant process, which is in a lot of ways the best model for developing kind of new programs that may even have a kind of an ability to have a replication effect. So other cities in Massachusetts might want to adopt the model. But the reason it's so unique is that your first year is a planning year. And so we were able to sort of look at the issue in all different ways, from the literature, from best practice across the country, from our own data in Worcester, and that's how we designed the model. Then in the second year, you pilot it. So with a very small number of people, and that can be frustrating. People get frustrated when you hear how that in a pilot you can only serve so many people,
Right.
but you need to make sure it works.
How many people were you able to service?
About 24.
Okay, that is small.
It is small, but we learned so much. And if we were to have gone full scale with the model, it would have been
What are some of the things you learned?
We learned, originally we were looking at young people still living with their family, but that their families were homeless, and looking at them as an at-risk group. But we realized that they were really part of a family homelessness situation. I mean, we knew that, but we looked at them because we knew that
You would find young people
who would be vulnerable
you know.
to become homeless as adults themselves. But we really found we were replicating the family kind of services. And so we shifted to more of the unaccompanied homeless youth in this implementation year. And rolling out the network has been a key feature of the third year. And so we'll be able to serve far more young people. I mean, you know, the numbers we're talking about are about 150 youth will come into the network, and a subset of them will get the intensive case management, but that all of them will get some service that they need that's appropriate for where they are. And then there'll be, ideally you have another year of implementation, but all throughout you're looking at sustainability. And the Commission is certainly a key piece of this, and that, working in partnership to, see how this model may or may not be relevant for the state.
The first